Have you ever felt alone, helpless, afraid, powerless? Now imagine feeling all those things at once when you're 15 or 8 or 2. These are the hard truths. Nationally, a report of child abuse is made every 10 seconds. Oklahoma currently ranks 44th out of 50 among states in the number of deaths related to child abuse and neglect. Every day in Oklahoma, 171 allegations of serious child abuse and/or neglect are investigated. Every day in Oklahoma, 35 incidents are confirmed as child abuse and/or neglect. Unfortunately, our legal system wasn't designed with these smallest victims in mind. For example, if a child happened to tell a teacher he was being hurt at home, the child would have to repeat his story to a principal, a counselor, a school nurse, a police officer, hospital nurses, a doctor, a social worker, a child protection investigator, and a lawyer 11 times. Even 25 years ago, a pediatrician in Norman realized our community needed to do a better job of caring for victims of child abuse. Dr. Mary Abbott, along with a team of caring citizens, promoted the concept of multidisciplinary teams of medical, law enforcement, social services, district attorney, child welfare, and counseling professionals working together on behalf of the children. Together, they led, guided, and mentored the first team into existence. Dr. Abbott personally became the first pediatrician in our community willing to administer sexual abuse exams for child victims and testify in court. That first Child Abuse Response Center, created by visionary Dr. Mary Abbott, is the Mary Abbott Children's House we know today. Mary Abbott Children's House is a beautiful historic home located in a quiet Norman neighborhood. This is a house, a home, with toys and furnishings that are designed to make the children feel more comfortable. In this one place, law enforcement officers, medical and mental health professionals, district attorneys, child welfare workers, and Abbott House staff work together to provide forensically sound interviews, provide sexual assault exams, minimize further trauma to the children, prevent further abuse, develop standards for consistent investigations, and minimize duplication of services. This is one of 2 special rooms our forensic interviewers use to help the children tell their stories. As you can see, the interior is simple to keep from distracting or influencing a child in any way. Digital cameras and sophisticated audio and recording equipment document the interviews that can be used in court. A child may find it easier to draw his or her story to explain what happened. This is a better way. Better for the children, better for law enforcement, better for prosecutors. Because the child tells his or her story one time, once in a controlled setting, the evidence is more credible. Since its founding, Mary Abbott Children's House has helped over 5,000 children tell their stories, leading to more cases filed, more counts charged, and more perpetrators found guilty. And this organized approach saves the community about $1,000 per case. In this fishbowl, each crayon represents every child who's come through our doors this year. Last year, that was 652 children, and we're seeing a 10% increase in the numbers every month this year. And you know what we all really wish? That it was none. That no child in Oklahoma was being abused. Have you ever felt protected, hopeful, heard, powerful?